How to take care of your knees. Anyone who exercises knows that ligament injuries, especially to the collateral ligament, are common. They're almost impossible to avoid. But there are some things you can do to strengthen them and improve their flexibility. How to take care of your knees. Watch your weight. When you're above your normal weight, the pressure on your knees increases. Every extra kilo adds more pressure each time you take a step. So keep an eye on your weight and try to maintain a balanced diet. Strengthen your legs to protect your knees. It's important to keep your legs strong because the tendons behind the thigh and the quadriceps, muscles at the front of the thigh, are the main shock absorbers when you exercise. Keep these muscles strong and flexible to protect the knee joints. Some exercises to strengthen the thighs include squats. Stand up straight with your back and head aligned, legs apart and shoulder width apart. Inhale and bend your knees and hips without arching your spine, then slowly return to the starting position. Repeat several times. Forward lunges. Stand with your legs together and hands on your waist, keeping your back and head straight. Step 1 foot forward and bend both knees, forming a 90-degree angle. Hold for 3 seconds, return, and repeat with the other leg. Stationary marching. Stand with feet apart and arms bent. Mimic walking by lifting the heels alternately without moving forward. Repeat 30 times, rest, then repeat again. Step-ups. Use a platform or step, stand up straight, place one foot on the step and lift your body up using that leg, keeping your back straight. Return and repeat with the other leg. Any exercise should be done under professional supervision to make sure you're not harming your health. Stretch your muscles. Muscle stretching can be done anytime, except before physical activities. There's no solid evidence that stretching before or after exercise has any effect. The recommendation is to warm up before any activity to avoid injury. Some stretches you can do to relieve knee pain. Squat stretch. Stand up straight with back and head aligned, legs shoulder width apart with feet facing forward. You can use a wall for support. Inhale and bend your knees and hips without lifting your heels and keeping your knees aligned with your heels. Hold for 5 seconds, then stand up again. Hip lift. Lie on your back on the floor, arms stretched out, and lift your hips to activate the glutes without lifting your shoulder blades. Hold for 30 seconds, or 20 if it's hard, then repeat. Hamstring stretch with a strap. Lie on your back with legs stretched out. Loop a towel or strap around the ball of one foot. Raise your legs straight up and gently pull toward you until you feel a stretch in the hamstring. Hold for 30 seconds, lower the leg, and repeat on the other side. Calf stretch with extended leg. Stand 1 meter away from a wall. Step 1 foot forward and the other back, with both feet aligned. Place hands on the wall and bend the back leg's knee until you feel a stretch above the ankle. Hold for 30 seconds, switch legs, and repeat. Hands to feet. Sit on the floor with legs stretched out in front of you, back straight. Try to touch your toes without bending your knees. Hold for a few seconds, then stop and repeat. Wear proper shoes to protect your knees. Your choice of shoes for exercising is one of the most important factors, as they reduce the impact on your knees. Wear shoes that fit your feet well. Get in shape first. If you're going to practice a sport that involves a lot of knee twisting like tennis, soccer, or basketball, make sure you get in shape first. These sports put a lot of pressure and impact on the knees. If you're overweight, try to lose some before starting. Remember, for any physical activity, it's very important to have medical supervision. If not a doctor, at least consult a physical education professional to make sure you're doing the exercises correctly.